The center was created in 2024. It was created when we received funding from the CDC. We work with our public health partners and others in the health systems and healthcare around the region to improve their ability to use evidence-based practices to improve public health preparedness and response, both from the public health perspective within the agency, as well as at the community level.
One of the focal areas of the University of Utah is disaster response. Because the university is located in a valley surrounded by mountains, we know a lot about extreme conditions, from high mountains and high elevation living to blizzards, droughts, wildfires, earthquakes. The University of Utah is positioned to experience all of those things, and so our research community engages questions related to disaster response.
It's been really valuable to have the center work with us to expand our ability to know how to respond to different emergencies, to be prepared for emergencies. Modeling is a great example of one of the things that we're working with them really closely right now, is trying to think of how diseases are coming, what's going to happen, what should we expect as things progress. Are there specific areas we could invest in, certain populations that we could invest in that are going to really change the whole trajectory instead of focusing across a whole group? So they've been able to bring together experts that have extensive training in modeling and really get them to work with us on these much more big picture complex questions than we usually are able to.
We are looking at making sure that everybody has access to the resources they need to keep themselves safe and healthy. We have some of the largest tribes in the nation. They live in very rural areas with pretty poor access to a lot of services and resources. And so it really is working with our tribes to make sure that they, as sovereign peoples, can have the resources and have the knowledge and the skill sets that they need in order to keep their community safe.
I myself am an enrolled member in the Cherokee Nation, and so I bring a different perspective as far as our tribal relationships and how those should be built. I think this is such a great pivot and learning opportunity for me to really be a part of this center and better understand how does mental health fit into emergency preparedness planning.
Our team is actually, I think, what makes us very unique in this space, because we have Dr. Schoaf, who of course is our director, and she comes with over 30 years of experience in this space, but specifically working with the public health impacts of earthquakes around the world.
We just came out of the field doing some data collection following the 2023 earthquake that happened in southern Turkey on the border of Turkey and Syria, and looking at what's the relationship between different types of building damage and different types and severity of injuries. And working with a group of engineers from UC Berkeley to do that data collection to really get the stories of the people who lived through that earthquake. And so we will take that information then and translate that into things that our healthcare systems and our public health systems can implement here in the United States as well as around the world.
We work in the space of emergency public health, right, which is a very distinct subset of broader public health. We fall under the National Incident Management System. As part of that is our incident command system. The key of ICS training is that we basically become plug and play with one another, and so we can avoid confusion. We all understand each other's roles, we understand the terminology that each other's using, and how things are going to happen. So it's a really key part of making sure that our disaster responses for public health and everyone else is efficient and effective.
We also want to drive collaboration between the university and departments of public health outside of the university, as well as between the university and communities. So the center serves as a central point to drive collaboration, and collaboration is the engine for all great research breakthroughs.
I think that the faculty, especially within our center, does a really wonderful job of mentorship, especially with students. That's been something that is a huge focus of our center, and how do we get more students involved and better understanding their communities and how to work with their communities.
The center is really great for students. I've had a lot of great opportunities here with the center that I probably wouldn't have had otherwise. It includes things like research, meeting people from all across both the Utah and the United States. I really like that collaborative aspect. I've gone to a few conferences. supported the center in a lot of different ways, both writing grants as well as writing papers and doing research.
There are a lot of problems that we have to solve, and my generation's not going to solve them. It really is going to be on this next generation that's coming up. And to have doctoral students be able to learn how to bridge that gap between pure research and public health practice, and the importance of what we do matters because it's going to be translated into practice, which is going to then be translated into improving the health of the population.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.